Hello everyone. Today we will explore the 20 most dangerous infectious diseases in human history. These illnesses have spread fear across continents, taken millions of lives, and left painful lessons for us all. 1. Smallpox. Smallpox was once humanity's greatest terror. Covered in painful pustules, survivors were often scarred for life. For centuries, smallpox killed hundreds of millions. Thanks to vaccination, the world officially eradicated it in 1980. Proof of the life-saving power of immunization. 2. Spanish flu, 1918. In just 2 years, this flu infected 500 million people, nearly 1/3 of the world's population at that time, and killed between 50 and 100 million. Most terrifyingly, it struck down young, healthy adults. It remains a grim reminder of how influenza can mutate and devastate. 3. Avian influenza, H5N1, H7N9. Unlike seasonal flu, avian influenza kills over half of those infected. While it has not spread widely among humans, the potential is chilling. Scientists monitor every outbreak closely to prevent another catastrophe. 4. SARS. Emerging in 2003, SARS lasted only a few months, but terrified the globe. With a 10% fatality rate, far higher than regular flu, hospitals were overwhelmed. Swift isolation measures stopped it, but the memory lingers. 5. MERS. First seen in 2012 in the Middle East, MERS had a mortality rate of up to 35%. Its limited spread spared the world a disaster, but every case raised alarm bells. 6. COVID-19. We all remember. Millions have died, economies were shaken, and daily life changed forever. COVID-19 is a modern warning. New viruses can strike any time, and preparedness is key. 7. Measles. Once considered a childhood illness, measles killed millions before vaccines. Even today, outbreaks occur in communities with low vaccination rates, proving how dangerous neglect can be. 8. Ebola. Perhaps the scariest of all. Ebola causes fever, internal bleeding, and death rates up to 90%. Each outbreak in Africa sparks global panic as containment is extremely difficult. 9. Marburg virus. A cousin of Ebola, Marburg also brings high fever and bleeding, with equally high fatality rates. Deadly outbreaks in Africa remind us of its lurking threat. 10. HIV, AIDS. Since the 1980s, HIV has killed more than 40 million people. It destroys the immune system, leaving patients vulnerable to other diseases. Though antiretroviral drugs save lives, there is still no cure or vaccine. 11. Rabies. Once symptoms appear, rabies is almost always fatal. Just one untreated dog bite can mean certain death. Vaccination of pets and quick medical care are the only protections. 12. Polio. This crippling disease once paralyzed millions of children. Iron lungs kept patients alive when their lungs stopped working. Today, vaccination has nearly wiped it out, but vigilance must continue. 13. Yellow fever. Spread by mosquitoes, yellow fever caused horrific outbreaks in Africa and the Americas. Victims suffered fever, jaundice, and internal bleeding. Vaccines keep it under control, but outbreaks still occur. 14. Dengue fever. Known as breakbone fever for its severe pain, dengue infects millions yearly. Severe cases cause bleeding and shock, sometimes leading to death. There is no specific cure. 15. Lassa fever endemic in West Africa. Lassa spreads from rodents to humans. It can kill quickly and poses risks for healthcare workers. Outbreaks remain a constant danger. 16. The Black Death, bubonic plague. In the 14th century, plague killed more than 75 million people, wiping out 1/3 of Europe's population. Buboes, fever, and rapid death made it one of the most feared epidemics in history. 17. Tuberculosis, TB. TB remains one of the world's deadliest infectious killers today. With symptoms like chronic cough and coughing blood, it weakens patients severely. Drug-resistant TB now makes treatment more challenging. 18. Cholera. Cholera can kill within hours due to extreme dehydration. Outbreaks in refugee camps and poor sanitation areas have taken countless lives. Clean water remains the best defense. 19. Typhoid fever. Caused by Salmonella typhi, this disease spreads through contaminated food and water. Before antibiotics, typhoid claimed thousands in major cities. It still affects millions yearly. 20. Whooping cough, pertussis. Although it sounds mild, pertussis can cause infants to stop breathing. Before vaccines, it killed thousands of children each year. Immunization remains critical. Closing message. These diseases are not just statistics. They are tragedies written in human history. But there is hope. Most can be prevented. Vaccination saves lives. Clean water, hygiene, and healthy living protect us all. Awareness and early treatment stop outbreaks before they spread. So, let us never underestimate infectious diseases. Share this knowledge, protect yourself, and protect others. Because in the battle between health and disease, prevention is our strongest weapon. Thank you for listening. Don't forget to subscribe to our channel, share your thoughts, and leave your questions in the comments. We love hearing from you.